Good morning. You are here for a cranial nerve exam, I see. Great. Can you verify your first and last name for me? Okay. Can you spell the last name? Thank you. And your date of birth? Okay. Have you had any head injuries lately? Okay, and when did that happen? And then since then, what has your pain level been on a scale from 1 to 10, 10 being the worst? Alright. Let's see. Any muscular disorders? Any medical issues currently, or any that you've had in the past? What about headaches? Do you currently have them often, or are they not very common? In regards to medication, do you take anything daily? And let's see. Any allergies to medication? Any numbness? Any palpitations? Alright. Just make sure I have everything I need. Okay. So this cranial nerve exam is unique because for this one, with the exception of a few things at the beginning, you will be able to keep your eyes closed the entire time. And we actually like to have you do that so that you're completely relaxed. And that just helps us get a good feel of your senses, your vitals, and just your health in general when you're relaxed and not anxious. Okay? It is up to you though. You don't have to keep them closed unless you want to. But like I said, we're just going to start with one part where I do need them open. So I just need you to look right at me. Very good. And you can just look at my nose and just blink like you normally would. Very good. Again, just checking to make sure your pupils are reacting properly to light. And no glasses or contacts. Okay. And when was your last eye exam? Alright. Good. Alright. Now, can you just tell me when you see my fingers wiggle in your field of vision? So again, just keep looking at my nose. And you can just say now when you see them wiggle. Good. 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 Okay. Everything is good with your peripheral vision. So now you can close your eyes for the rest of the exam. So just relax, and I'll be guiding you through each part of the exam. So for this next one, I'm actually going to turn off all the lights, so just give me one moment. So now it's completely dark in the room, which I'm sure you can tell. So just keep your eyes closed, because what I'm going to do is just shine a light in front of your face, and then what I need you to do is tell me when you see it. Again, with your eyes closed. So you should be able to just see the light flash in front of your face with your eyes closed. Okay? So here we go. Good. 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 Alright. Perfect. You can still keep your eyes closed, but I'm now going to turn the lights back on for the rest of the exam. So I'm just going to feel around your eye area. So just stay still for me. And just let me know if you feel any pain or tenderness. Starting with your left eye. Okay, right above. No pain. Good. Now your right eye. No pain. Okay, good. Now I'm just going to palpate your face a little bit. So again, should not hurt, but let me know if it does. Any pain? Good. Alright, so now let's listen to your heart. Any history of heart trouble? Anything that runs in your family? Good. So I'm just going to put this on your chest, if that's okay. And just deep breaths for me. Alright? Breathe in. And breathe out. Good. Breathe in. And breathe out. Breathe in. And breathe out. Good. I'm just going to put this on your back. breathe in and breathe out. Good. Now one big deep breath. Good. Okay. I guess we'll test your blood pressure next. So, any history of high blood pressure? What about in your family? Wonderful. Let's just get this on you. Put your arm right in here. Perfect. And we'll just place your arm. Put these back in. Alright. So this will just get tight for a few seconds. Okay. Very good. So, blood pressure is normal. And I did mean to ask you about your diet. Do you eat pretty healthy? Okay, so fruits, vegetables. Okay, what about caffeine? Okay, very good. So I'm going to just make note of that as well. Now we're just going to look at your ears. I'm going to first take a look at your eardrum and make sure everything looks healthy. So for that, I will be using my otoscope here, and we're just going to get a clean piece right here. And this will just allow me to see your eardrum. Okay. So, perfect. To make sure there were batteries in there. So I'll start off with your left ear. Just turn your head a little bit for me. Good. I'm just going to take a look. So, everything looks pretty good. When is the last time you had your ears cleaned? You don't remember? Okay. Well, I would suggest getting them cleaned somewhat soon. There's a little bit of wax buildup. Nothing crazy, but just good to have them cleaned every year-ish. If you don't go every year, that's okay, but it will help your hearing, so it's always good to just do it. Alright, so just a quick hearing test. Just keep your eyes closed, and they've been closed the whole time, which is perfect. I'm just going to whisper a number on each side of your head, and I just need you to tell me what number I'm saying. Alright, here we go. 3, 15, 64. Good. 7, 25, 18. Good. 35, 92. Good. And one more. 16, 38, 62. Very good. And you said you have not experienced any hearing issues? still have that head pain from the injury, but so far everything is checking out fine, which is a good sign. So now I'm just going to test your facial nerves. And this is very important, especially since you had a head injury. Okay? So the first nerve test involves this right here. It's just a water globe. And it's used to just promote circulation on your face. It's really good for massages. But I'm just going to place it on your face. And whenever you feel the cold, just say yes. Okay? So here we go. Cold. 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 Alright, perfect. Now the sharp or dull test, which is very common for cranial nerve exams. So I'm going to place a sharp sensation on your face. It's not really sharp though. It's just going to feel a little bit pointy. And then the dull sensation is just a brush. Again, just keep those eyes closed. Say sharp or dull based on what you feel. Okay. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Alright. Perfect. I'm actually just going to do the same exact thing on your arms. Alright? So just keep your arms at your side, just as they are. And I'm going to start with your left arm. Dull. Dull. Sharp. Sharp. Good. Now let's do your right arm. So here we go. Dull. Dull. Very good. Sharp. Sharp. Perfect. Now on to your sense of taste. So I have 2 different taste drops, and one will be sweet, one will be a little sour. Alright, so when I say, just open your mouth a little bit for me, and I'm going to just place a drop on your tongue. I promise both of these do not taste bad. So just tell me if you taste something sweet or sour. Okay. Here is the first one. Alright, so mouth open. Very good. What do you think? Good, good. That was sour. Let's try this one. Mouth open again. Very good. Sweet. Perfect. And now one more. Mouth open. Good. Sour again. Perfect. So taste is good. Alright. Just want to real quick have you smile for me, real big. Good. Now frown. Good. Now puff out your cheeks. Very good. Okay. Any pain with any of those movements? Good. Now can you shrug your shoulders? Good. And I'm just going to push down on your shoulders to shrug them up again. Good. Then I'm just gonna push. Okay, good. Good job. And then move your head from side to side. Good. Any pain? No. Okay, good. Very good. Now just hold your arms out in front of you, palms up. Good. I'm just going to push down and just resist. Very good. And once more. Very good. So I'm going to have you just hold one side of your nose at a time. Just push out your nostril. I'm going to test one at a time and make sure both sides are working. So you can start with whatever one you choose. Good. I'm going to put a scent under your nose. You just tell me what it is. So what is that scent? Lemons. Very good. Let's get the second one here. There are 3 total. So can you cover your other nostril? Good. Tell me what this one is. Good. Chocolate. And then now you can just not cover either of them. And we'll see if you get this last one. Good. Yep. It's flowers. Any trouble with the scents at all? Do you feel like you struggled? Alright, perfect. So sense of taste, good. Sense of smell, good. Alright, so just making sure we covered everything. So I am going to clear you. Even though you did suffer that light head injury, I don't notice anything abnormal. You are in great health, which is great, and I'm glad you're recovering so quickly. So I'm going to send the exam results to your doctor, and then I'm sure he'll reach out with any follow-up advice he has for you for your recovery. Okay? Do you have any questions for me? And by the way, you can open your eyes now. Did it help you relax? Good. Well, I'm glad you were able to enjoy the exam somewhat. And thank you for coming in today. And you can check out at the front desk Any questions or concerns, just give me a call. So take care and feel better soon.